I'm going to palpate the Splenius Capitis muscle, which is a head and neck extensor, and it also rotates ipsilaterally, so same side, and also laterally flexes the head to the same side. So the Splenius Capitis is going to attach superiorly at the mastoid process of the temporal bone here. So this is just behind the ear. We're going to come and feel the rounded mastoid process. Now you can see here the SCM muscle on the lateral side of the neck is anterior to the Splenius Capitis. So I'm going to feel the border of SCM, and I'm just going to come posterior to it. So that's the part of the mastoid process that's going to be the superior attachment for the Splenius Capitis. Now, it's going to run distally from here down to the spinous processes of C3 to T3. Some literature says C4 to T4. It's pretty close. So how I'm going to find that is I'm going to find the occiput here, which is the bumpiest part of the back of the head, and I'm going to come inferiorly until I feel sort of a void space, and that is going to be where C1 is. And then I'm just going to count my vertebrae down. So they're usually about the width of a finger. So there's C1 here, C2, C3, so that's where it starts, and then C4, 5, 6, and there's C7 there, and then T1, 2, 3. So this is the distal attachment for Splenius Capitis. Okay, so the muscle is going to run mastoid process inferiorly down to the spinous processes of C3 to T3. And how I'm going to get my partner to activate it is I'm just going to get you to slightly lift your head and turn to the same side. That's perfect. And I can just feel, so SCM's here, and it slackens when we do this. And so I'm going to feel this sort of chub bit here, and I'm going to feel it all the way down to around T3. Thank you. I'm going to palpate Splenius Cervicis. Splenius Cervicis, like Splenius Capitis, is also a head and neck extensor. It also rotates the head to the ipsilateral side, so same side, and it laterally flexes the neck to the same side as well. So this muscle, I'm going to start with the inferior attachment. It sort of picks up where Splenius Capitis leaves off, and it starts at spinous process of T3 to T6. So to find that, I'm going to find my most prominent spinous process, which is C7. I'm going to turn his head passively back and forth, and I can feel that that's part of the cervical spine. So then I'm going to count downwards. So there's C7. I'm going to go T1, T2, and there's T3. So that's the beginning. And then T3, 4, 5, 6. Perfect. So this is the inferior attachment right here. Now, the superior attachment, okay, the Splenius Cervicis is going to come up this way. It's a little bit stringier than the sort of thick and flat Splenius Capitis. It's going to come superiorly and attach to the TVPs of C1, 2, and 3. So to find the TVPs, I'm going to keep my hand over here in the at the inferior attachment. I'm going to find the mastoid process, again, just behind the ear, and I'm going to come sort of anterior and inferior to that until I feel, I drop off, and I feel the prominent C1 TVP right there. Now just be careful there. It's a really sensitive spot, and there's lots of vascular and nerve structures in here. So there's TVP of C1, and then C2 and 3. So what I'm going to do is I'm just going to sink in here, press against those TVPs, and I'm pressing against the SPs inferiorly, and I'll have my partner just extend and ipsilaterally rotate his head. Perfect. And I can strum across it right there, and I feel it also pop up here. Thank you. It's difficult to palpate it beyond sort of the neck area down in here because it is deep to a bunch of other things, the upper traps and the rhomboids, to name a couple. So that I find is the easiest way to do it.